Hello and welcome. Today, we're going to tackle a name that I'm sure most of us have heard, usually in some pretty scary headlines, but very few of us actually understand anthrax. So let's dive right in and separate the real facts from the fear. Yeah, when you hear the word anthrax, this is probably what flashes through your mind, right? The 2001 attacks in the United States really cemented its reputation as a biological weapon. But that's just one very small, very specific piece of a much, much bigger story.
So, what is it really? Well, at its core, anthrax is an infection, and it's caused by a bacterium. This isn't something man made in a lab, it's a totally natural organism called Bacillus anthracis. The real danger, the thing that makes it so potent, is the incredibly tough spores it forms and the powerful toxins it churns out once it's inside the body.
To really get a handle on this, we're going to follow a clear path. First, we'll cover the basic science of what anthrax is. Then, we'll get into how it actually spreads. After that, we'll look at the different ways it can affect the body. And finally, and this is important, we'll cover how it's diagnosed, treated, and even prevented. All right, let's get to it. First up, the science. We really need to look past the scary headlines to understand the organism itself. So, Bacillus anthracis is a type of bacteria that you can find in soil all over the globe. It's mainly a disease that affects animals like cattle, sheep, and goats. But here's the crucial point. It creates these unbelievably tough spores, and those spores, they're the main way it causes infection. Think of them less like active bacteria and more like tiny dormant seeds just waiting for the right conditions to spring to life. And when I say tough, I mean it. Their resilience is just astonishing. The fact that these spores can survive in the environment for decades, well, that's exactly what makes them such a persistent potential threat, both in the wild and, unfortunately, as a weapon. Okay, so if it's naturally in the soil and infects animals, how in the world does it make that jump over to people? Let's break down exactly how it spreads. The most common pathway is actually pretty straightforward. It starts with grazing animals picking up spores from the soil. Then, people who work with these animals or their products, we're talking things like wool or animal hides, can get exposed. From there, the spores just need a doorway into the body, which could be a cut in the skin, breathing them in, or even eating contaminated food. Now, this is a really important distinction. By far, and I mean by a long shot, the most common way people get anthrax is through simple skin contact. These other routes, like inhaling the spores, eating contaminated meat, or very rarely injecting contaminated drugs, are much less common. But, and this is a big but, they are often way, way more dangerous. And here is a huge piece of information that should really put your mind at ease. Unlike something like the flu or a common cold, anthrax generally does not spread from person to person. With the very rare exception of someone touching an open skin sore, you simply can't catch it from someone who has it. So we know how you can get it, but what does it actually do? Well, the infection looks pretty different depending on how the spores got into your body in the first place. Let's take a look at the 4 different phases of anthrax. We'll kick things off with the most frequent type, the one that accounts for the vast majority of cases all around the world, cutaneous or skin anthrax. This is what happens when those spores get into a simple cut or scrape on your skin. The way this develops is super distinct. It starts out as an itchy bump, a bit like a bug bite. That bump then turns into a blister. And finally, the blister breaks down and forms this classic painless black scab, which has a medical name, an eschar. Now, while it looks pretty nasty, the key takeaway here is that with antibiotic treatment, death from this form of anthrax is very, very rare. Okay, now we're going to shift gears to the form that everyone fears, and honestly, for very good reason. Inhalation anthrax is without a doubt the most serious and deadly form of this disease. What makes it so incredibly dangerous is its 2-stage attack. At first, it just looks like you have the flu. You might have some mild aches, maybe a little cough, a low fever. But then, after a few days, it suddenly takes a very sharp, very dangerous turn. The patient will rapidly develop severe breathing problems, a high fever, and go into shock as the bacterial toxins just overwhelm the body. And this number, well, it says it all. Without treatment, the mortality rate for inhalation anthrax is practically 100%. Even with fast, aggressive medical care, it is still incredibly difficult to survive once those severe symptoms kick in. That is a terrifying statistic, I know. But this brings us to a really crucial part of the story: how the medical community actually fights back. So let's talk about diagnosis and treatment.
So, doctors have a few tools in their belts. For the skin version, that distinct black scab is a huge visual clue. For the inhalation type, a chest x-ray or CT scan can show some telltale changes. But really, the gold standard for diagnosis is confirming the bacteria is there by taking samples of blood or fluid and actually growing them in a lab.
And here is the good news. Anthrax is a bacteria, and that means we can fight it with antibiotics. As you can see here, the treatment really depends on the type of infection. Skin anthrax can usually be handled with simple oral antibiotics, but the more serious forms, like inhalation, they require a long, aggressive course of multiple IV antibiotics, sometimes for 60 days or even longer. And in the most severe cases, we can also use these advanced antibody therapies designed to hunt down and neutralize the specific toxins the bacteria releases. The main point is, catching it and treating it early is absolutely critical.
So, if we can treat it, can we also prevent it? Let's move into our final section here, staying safe and understanding the risk. Prevention really comes down to two main strategies. First, there is a vaccine, but it's for people in high-risk jobs, think military personnel, veterinarians, or lab workers, who might come into contact with bacteria. Second, and this is just as important, is something called post-exposure prophylaxis. This means if someone is known to have been exposed, they can be given a course of antibiotics and the vaccine right away to stop the infection before it ever gets a chance to take hold. And this all brings us to one final, crucial question. If natural anthrax in humans is so incredibly rare, why do we dedicate so much time, effort, and resources to understanding and preparing for it?
Well, the answer is that understanding a threat is the very first step to neutralizing it. Being prepared for both rare natural diseases and potential acts of bioterrorism is really a cornerstone of modern public health. By knowing how something works, we take away its power to cause panic and fear. Thanks so much for joining us for this explainer. If you found this useful and want to understand more complex health topics in just a few minutes, be sure to like, share, and subscribe to MediByte. We'll see you next time.